This section is not designed to train or certify any student on medical, first aid, CPR, AED use, choking, or other responses. Certification courses for specific medical training is optimally to be provided by security agencies. This class obviously is not long enough to include a first aid and CPR and AED course, which is approximately 8 hours in length. One of the more common medical emergencies that a security professional might find themselves responding to is that of a heart attack, or commonly referred to as a cardiac arrest. Some of the symptoms that are outlined over here for a heart attack are similar to issues that occur with other medical emergencies as well. But if you have somebody that potentially has a history of a heart condition, they've had a heart attack before, this is probably measuring up to the probability that you have a heart attack issue that you're dealing with. When you encounter a person who may be having a heart attack, first thing is to immediately contact 911 or have somebody do it for you, as we would for any major medical emergency. If the person experiencing the heart attack is unconscious, not breathing, and has no pulse, one option you can consider is beginning cardiopulmonary resuscitation, better known as CPR. If you have not received CPR training, doctors recommend only performing chest compressions at a rate of 100 beats per minute. This is known as hands-only CPR. It does not involve mouth-to-mouth resuscitation. Those professionally trained on CPR will do both chest compressions by hand and breathing by mouth. 911 dispatchers may even be able to instruct you on proper CPR procedures. Dr. Alison Aneda from Hawaii came up with the great idea to use the mathematically perfect and very memorable Bee Gees disco classic, appropriately named Staying Alive, which allows you to time out chest compressions. The song actually came from the 1970s movie Saturday Night Fever, starring John Travolta.
Everyone should know how to do hands-only CPR.
Guys, watch out. Actress Jennifer Coolidge is setting hearts aflutter in a new public service announcement.
Just push to the beat of the classic song, Staying Alive.
The PSA is part of the American Heart Association's campaign to demystify cardiac pulmonary resuscitation. No more complicated timing of breaths to chest compressions, no more mouth-to-mouth even. There's now just 2 simple hands-only steps, and everyone at a recent event featuring Coolidge had gotten the message.
Call 911
and do hands-only CPR.
Push hard and fast in the center chest, going along with the song Staying Alive.
It turns out the Bee Gees disco hit is actually helping people stay alive, thanks to this man, a professor in Hawaii who put 2 and 2 together.
So I thought it'd be great if I could find a song that had a great beat of 100 times a minute. I actually played the song Staying Alive in class, and it was really fun. You know, people started busting out the disco moves and doing CPR.
Does it work? Just ask Tom Maimone, who 3 years ago collapsed in the middle of his daily run.
I fell directly on my head. I had a knot the size of a golf ball on the left hand, still there. And they found me laying on the ground.
A stranger who also happened to be named Tom was nearby.
I've never taken a CPR course in my life, and here I am, you know, kneeling over this guy who is not breathing, and it popped into my head a segment I had seen on a morning news show only about 5 months prior to that. And the reason that I remembered it was as simple as doing it to the right rhythm of the Bee Gees song, Staying Alive.
He kept it up for 9 minutes until the paramedics arrived.
This man saved my life. I'm here talking to you just because he acted as my heart for 9 minutes. And it's really simple.
If you see someone who kind of looks inept, like myself, saying, I know how to do CPR, I think it's actually more powerful.
So simple, even Stifler's mom can do it.
I could be at like someone's bar mitzvah and like save someone just by doing CPR. I would like to be that person. And now I'm actually in the possibility gang because I know how to do CPR. I could actually be that person.
It's true that an incident is most likely to happen to a family, friend, or coworker near you. Deborah Bader was on a walk with her husband when he suffered sudden cardiac arrest.
I'm not a doctor, I'm not a trained anything. I just seen online the video on how to do it, and it stuck. It was easy to remember, and it saved Christopher's life.
The living examples are unfortunately few and far between. Nearly 90% of people that suffer sudden cardiac arrest outside of a hospital die because they did not immediately receive CPR. A lot of times it's because people nearby don't know what to do or because they're afraid of hurting the victim. Tom Maimone has a stark answer to that.
You can't hurt me. You can't. I'm the guy on the ground dead. If you don't touch me and you don't do anything, I'm the guy that they're going to put in the box.
Thanks to the quick actions and fearlessness of a stranger, now a close friend, he's dancing. With Everyday Health, I'm Stephanie Sy.
Defibrillation is an electrical shock delivered to the heart designed to terminate a life-threatening arrhythmia or cardiac arrest. The automated external defibrillator, known as an AED, is a device capable of automatically detecting a heart rhythm that requires a shock. AEDs are normally located in most public areas and other locations, so find out where they might be located on your property. An AED should be brought to medical scenes where your patient is experiencing these outlined conditions we spoke about, such as being unconscious, having no pulse, not breathing. An AED is designed to be user-friendly, and theoretically anyone can open the box, press the button, and be instructed on its use. Regardless, using one during a stressful medical incident is probably not the best time to be learning how to actually use the AED. If possible, review these AED kits during your on-the-job training. And also a CPR first aid course will include use of an actual AED as well. Every minute a stroke goes untreated, roughly 1.9 million brain cells die, which can lead to long-term disability and even death. Our goal with a stroke is to make sure that somebody gets medical attention as soon as possible. On scene, there's not a lot you can do as an untrained medical professional. Some of the symptoms you might be taking a look at would be potentially somebody's face that's becoming uneven, their arms might be drifting, and then their speech might be slurring as well. So again, priority there is to make sure that 911 is called and medical attention is on the way. Finding somebody who might be choking can occur just about almost anywhere. Potentially there is an increase in a restaurant environment, but also small children who are likely at times to swallow small objects also are vulnerable to this. The thing that we want to remember as response to this is the Heimlich maneuver. For a patient with minor bleeding, such as a small laceration or a cut, things you want to remember are to obviously apply those gloves prior to assisting anyone who is bleeding. Remember your biohazard training on this. Simple wounds such as minor scrapes or cuts require holding pressure to the wound to stop the bleeding. Elevate the wound if bleeding continues. If it does continue after exerting pressure for more than 10 minutes, then you want to definitely seek medical attention. There are three main types of bleeding. The one you want to be most concerned about is arterial bleeding, which is the most severe and urgent type of bleeding. It can result from a penetrating injury, blunt trauma, or damage to organs or blood vessels. A person with severe blood loss can bleed out within 5 minutes. Your response to bleeding would be first to apply pressure with your hands. Secondly, to apply dressing and continue to press on that wound. Again, the goal here is to keep as much of that blood inside the patient as possible. It's pretty a simple concept. If it's possible and necessary, you may even need to potentially apply a tourniquet. Now, tourniquets are becoming a lot more widely available in first aid kits. First responders usually carry them right on them. If you have the opportunity to receive some training on it, please make sure you do. The use of a tourniquet can absolutely save somebody's life in a severe bleeding situation. There are things short of using a tourniquet, such as a piece of clothing or a belt, which also can be applied, but more optimally it would be, again, that use of a tourniquet. Skeletal injuries or broken bones will require professional medical attention. Until that arrives, and to properly treat the patient, you want to try to immobilize the fractured area as best as possible and potentially apply some ice packs or ice to the area, which may help limit the swelling. Shock is usually more of a secondary issue with your medical patients. Shock usually occurs after somebody has had a traumatic accident or injury, and some of the signs that you want to be looking out for is these 5 things that are outlined over here. Shock is a life-threatening situation, and you want to make sure that it is addressed, and you want to make sure also that you're pointing it out to medical first responders when they're arriving at the scene that somebody potentially is in shock. Persons that are experiencing a seizure will be quite a unique scene, especially if you haven't been on one before. One of the perspectives that you want to consider is the actual onlookers or people that are on your scene with you, because a lot of times the response to working on somebody with a seizure is to actually let the seizure work itself out without trying to hold somebody down or control their movements too much. You want to try to do everything you can in order to keep the area near them safe. But what I mean by onlookers is, again, there are a lot of people that will believe that you're not trying to do anything in order to help, and sometimes you just simply need to explain that to them, that you have to kind of let these things work themselves out. And a seizure can last anywhere from 30 seconds to 30 minutes. There's no rhyme or reason to exactly how long they might potentially go on. You do want to try to time them out if you possibly can, and report that to the medical first responders when they're getting on the scene. When somebody is coming out of a seizure, you want to get them into that recovery position, loosen any tight clothing that might be on them, and again, cushion their head or anything else like that in case the seizure attempts to come back or re-erupts. Again, this can happen to anybody. In particular, small children who have recently had a very high fever are very vulnerable to seizures as well. Security professionals responding to medical emergencies should generally refrain from administering medications. However, there are circumstances where limited assistance can be provided. If somebody possesses their own medication, prescribed or over the counter, what security professionals can do is make it available for them to be able to administer it to themselves. You may assist in placing medication in someone's hand or gathering it from them at their request, but again, you're not a medical professional and you should not administer medications. Often people with known heart conditions may be prescribed what we call nitroglycerin to help them out, and there are other medical conditions that people may have their medication available and on hand as well. Taking aspirin during a heart attack could reduce heart damage by helping somebody's blood keep from clotting, as it is a blood thinner or what is known as an anticoagulant. Aspirin can interact with other medications, so it's always wise to make sure a medical professional recommends it. 911 operators may direct you to provide aspirin if it's available. Aspirin should be clearly marked and not mistaken for other over-the-counter medications such as ibuprofen, commonly known as Advil, Motrin, and some other brands as well. And also it should not be confused with Tylenol, which is acetaminophen. Diabetics may often need to eat or drink to raise their blood sugar levels, but that would be medical information they should know and follow themselves. Assisting with obtaining whatever they might happen to need is an acceptable practice for security professionals. For certain medical issues, especially those involving abdominal, stomach conditions, it is not advisable to provide fluids. Illegal drugs or controlled dangerous substances may be issues security professionals can expect to respond to at their property locations. Most likely, properties with more public exposure can expect to have these interactions more frequently, but they can occur anywhere. When interacting with a person experiencing a reaction to drug use, security professionals must remember to treat it as a medical issue and not be overly concerned with the criminality that may be involved. Prosecution and investigation are primarily the responsibility of law enforcement. Security should concentrate on this issue as a medical response. Your immediate priorities are getting first responders en route. Past this, drug scenes require all first responders to keep their personal safety in mind. Remember PPE, protective gloves, and keeping your distance from any paraphernalia. There are different types of drugs and many different ways people can potentially react to them. Security professionals will generally not be able to decipher the differences, but again, the priority is the patient and the medical issues they are presenting with. Hopefully your victim will be conscious, and if they are, they may be reacting such as feeling hot, anxious, or agitated. Try to move them somewhere where it's cooler and quieter and attempt to keep them calm. Continue to monitor them as they may lapse into other more serious medical reactions. Should someone be semi-conscious, attempt to move them onto their side or into that recovery position so their airway has the best chance of staying clear and open. Should they become unresponsive or stop breathing, then you would have to consider CPR and have an AED brought to the scene as well. Your knowledge and observation about two particular drugs may be relevant as to response. Both heroin and fentanyl are drugs which are very prevalent based on their access and availability. Over 150 people die every day from overdoses related to synthetic opioids like fentanyl. First off, contact and proximity are primary concerns for anyone interacting with fentanyl. Some persons have been known to have had severe, even life-threatening reactions just from being within the vicinity of this drug. Fentanyl has actually been around since the 1950s. There are two types of fentanyl, pharmaceutical fentanyl and illicitly manufactured fentanyl. Pharmaceutical fentanyl is prescribed by doctors to treat severe pain, especially after surgery. Most recent cases of fentanyl-related overdose are linked to illicitly manufactured fentanyl. Today, fentanyl is an abused substance that when added or cut with other drugs makes them more potent. Persons taking this drug for the first time have experienced serious complications or even death. There are some very distinctive signs if an individual is reacting to heroin or fentanyl. They will have difficulty breathing. If they are unconscious, it will be very difficult to wake them up. They are in a very deep transient sleep. They will be perhaps snoring or grunting very loudly. You potentially could notice that their lips will be turning blue or their fingertips blue. That's a sign of loss of oxygen. Fentanyl actually is a drug that is designed to tell the brain basically to stop breathing. Security professionals, first responders, and even ordinary people are learning of an accessible drug called Narcan or naloxone, which can be used to possibly reverse the effects of heroin and or fentanyl. This is now being instructed in first aid courses, and training on administration takes less than an hour. Narcan is normally a nasal spray administration. It may take several hits or doses of Narcan to revive such a victim, and those in the area of the administration should be cautious, as the victims that are regaining consciousness, when they're coming out of it, they may be slightly combative. Now moving on to fire emergency response. Some of the greatest potential dangers to a property that a security professional must be vigilant against are fire and smoke conditions, which are normally the result of an actual fire. Every 20 seconds, a fire department responds to a fire somewhere in the United States. Once a minute, a fire occurs in a structure. Remember your priorities in the event of a fire at your facility. You want to activate any available fire alarms, PA systems, or other methods to notify building occupants they need to evacuate. And of course, 911 to report the fire and get your response on the way. If possible, break these duties up among 2 or more security officers if they're available to expedite response. Often fire alarms, smoke detectors, and even fire suppression systems will activate before people observe an actual fire or smoke condition. If so, begin the evacuation process and attempt to locate the area and source of the fire, being mindful again of your scene safety. When assisting with evacuation, follow your property-specific evacuation procedures and calmly guide everybody that's inside away from the property. Remember, elevators should not be used during a fire or a smoke condition. Security professionals should be aware of locations of fire extinguishers strategically located throughout their properties. Please review the attached video on the use of fire extinguishers. Most people are surprised to learn fire extinguishers may not be as effective as they imagined. An average-sized extinguisher will disperse all of its fire extinguishing agent within 8 to 10 seconds. Therefore, security personnel should not feel overly confident about putting an extinguisher up against a mid to large-sized fire. If the fire is small in size, attempt to put it out with the fire extinguisher as a way to minimize damage to the property. However, this is not a time to be overly confident about what you can accomplish with a fire extinguisher. If a smoke or fire are overwhelming, retreat immediately. Most fire deaths are not caused by burns, but smoke inhalation. Often smoke incapacitates so quickly that people are overcome and can't make it to an otherwise accessible exit. The synthetic materials commonplace in structures produce especially dangerous substances. As a fire grows inside a building, it will often consume most of the available oxygen, slowing the burning process. This incomplete combustion results in toxic gases. The memory device you should keep in mind when using an extinguisher will be explained in the video that's to follow. But you want to remember PASS. Pull the pin, aim low at the base of the fire, squeeze the trigger, sweep from side to side until the fire is out. The video you're about to see actually jumps forward to the section of explaining fire extinguishers, so just stick with it a bit. It does skip around in the beginning. And to conclude this section on fire and smoke conditions, we also want to include chemical accidents and hazardous material exposures. Again, your response for those type of things would be to immediately contact 911. Be as specific as possible to what chemicals might be involved. This is also where knowing where your chemicals are specifically stored on your property is very important. And you want to obviously attempt to evacuate people as far away as possible and await first responders. Moving next to our responses on natural and man-made disasters. The Department of Homeland Security explains the United States will never be completely impervious to present and emerging threats and hazards across the nation. Preparedness is a shared responsibility for governments, the private sector, and the American people. A natural disaster might be a flood, an earthquake, a tornado, or a hurricane that causes great damage or loss of life. A man-made disaster results from intent, negligence, or error. So let's explore some of the disasters that may unfold in our world of professional security. This by no means will be an exhaustive list, but there are some here that are familiar major incidents that have potential to occur with little or no warning. Bomb threats or other types of threats made against a property can be received by a number of different means, including over the phone, mail, electronically through a computer, email, social media, or other means. Threats should be reported to management, who in turn should evaluate any threats with law enforcement. Unless and until actual evidence of a threat exists, any decisions to evacuate, search, or otherwise respond to the threat usually involve the collaboration between management and law enforcement. Management is usually presented with what options they have regarding their buildings and what they're going to do in response to the particular threat. Security and management should evaluate any recent issues which might spur a threat against the property, such as employees who have recently been terminated or left on bad terms. Is the property open to unfavorable or controversial public reactions based on the business they conduct, so on and so forth. Security's assistance will be determined based on management's plan to deal with the individual threat. This might include cursory checks of the property for anything unusual or suspect. Obviously, anything that stands out requires a halt to operations and intervention by professional first responders. One traditional method of evaluating a threat might be a bomb threat checklist, which in theory means a person that's making a threat against the property calls in, and somebody on the other end at the property takes the phone call, and they use this bomb threat call list to evaluate what the caller is saying and elements of the actual threat. Now, this might be somewhat aspirational and probably an unlikely method of evaluating. When I was in the industry, I never actually seen this occur the way that it was lined up to occur. Regardless, the practice is still taught and active in security and law enforcement world, so you need to be aware of it. One threat trigger in public places is the unattended bag or package. If possible, usually using CCTV, attempt to track down how long the item has been left in an area or who may have left it. Many times, items that appear suspicious may have been accidentally left behind, mislaid, or forgotten. Regardless, if you observe anything suspicious or if an item has an obvious marking such as wirings, triggers, or any unusual circumstances such as an odor or something leaking from it, and they're immediately presenting themselves, you want to distance yourself, evacuate the area, and again, get those first responders on the way as soon as possible. The same holds for packages delivered to your property that may be abnormal or reported as abnormal. Outlined on the screen here are some of the markers to be observant for if they're observed, and they most likely deserve additional scrutiny and immediate separation. Some of you may be familiar with Ted Kaczynski, who was the Unabomber back from the 1990s. There was anthrax attacks, anthrax or another type of a substance that was sent through the mail. This was about a couple of weeks after 9/11, if you remember that from years ago. Mail bombs in general, if we're looking at them realistically, they're made to go off when somebody actually opens a package. There have been threats where people have actually opened up a package and they've discovered that, there's something that appears to be an explosive device inside or made to look like that. There may be road flares that are taped together, an alarm clock, so on and so forth, kind of rudimentary items. And those things, that's not an actual, although it's alarming, it's not an actual bomb at that point in time. Okay, so it's more meant as a way of trying to scare somebody or terrorize them when they're actually opening it to believe that it would. A true mail bomb would actually explode upon impact. So moving on to power outages that can occur at your property. Security professionals should be aware of where the temporary or backup lighting sources exist on their properties. That could be generators, where flashlights are actually stored, where there's emergency lighting. You want to also understand what emergency power will provide, what type of minimal coverage it will provide, what's going to be working when the lights and the power go down. Your cell phones are going to be essential in this circumstance because your landlines are not going to work. Most of them are hooked up to electricity and the internet now. Alarm responses, alarms may be triggered because of power outages, and then you have to take a look at anything else that might particularly affect your property that you're working at. Historically, Delaware has not been prone to having earthquakes, but they have occurred and they can affect any state. Even if they are centered in other states, their effects can be felt for hundreds of miles away. Please review the short video attached on earthquake preparedness. Delaware is vulnerable to tornadoes. They have occurred in all parts of the state and affected many different communities and structures, and resulted in serious injuries, death, and even property loss. Delaware, while one of the smaller states in the Union by landmass, is the 5th flattest state with relatively few mountainous areas to stop a formed tornado. However, most supercell variety tornadoes, which are 2.0 or higher on the Fujitsu scale, are unlikely. Security personnel should pay attention to watches and warnings posted for their areas and prepare others under their purview as a precaution. See the attached video on Get Weather Ready, what to do during a tornado.